Welcome to the Wellbeing Podcast, where every episode is a step toward a healthier and happier you. Let's grow, thrive, and shine together. You've been digging into the idea of well-being, especially how it all ties into public health. You sent over a really interesting mix of stuff economics papers, reports from the CDC, even some philosophy. So let's dive in and see what we can uncover.
It sounds like you're ready to explore the fascinating world of well-being and its impact on public health. Let's unravel this together.
Okay, so right off the bat, one of the things that really struck me was this story about villagers in India. Researchers found that even though they didn't have a lot of money, they reported higher levels of well-being than people in wealthier areas. It kind of makes you wonder, doesn't it?
It certainly does. That story challenges the common assumption that money equals happiness, doesn't it? This is where understanding well-being as a multifaceted concept becomes really important. What's fascinating here is that it suggests that there's more to a good life than just financial wealth.
Right. There's this whole other dimension we often miss when we're focused on material things. And it makes you think, if money isn't the key to happiness, then what is?
That's a question that economists and social scientists have been grappling with for decades. And it brings us to the work of Richard Easterlin and his discovery of what's known as the Easterlin paradox. He found that in wealthier countries, there wasn't a strong connection between income and happiness. Once people's basic needs were met, more money didn't necessarily lead to more happiness.
So chasing a bigger paycheck might not actually make us happier in the long run. I guess that makes sense. There's more to life than just accumulating wealth.
Exactly. And Robert Lane's research in the U.S. supports this idea. He found things like having a satisfying marriage, good self-esteem, and enjoying leisure activities were better predictors of happiness than how much money someone made. It really makes you think about what we truly value in life.
Okay, so we got this idea that well-being isn't just about money. But if it's so multifaceted, how do we even begin to understand it?
That's where the different conceptions of well-being come in. Some philosophers, like Derek Parfit, have pointed out that there are many different ways to think about what constitutes a good life. For example, some people believe that happiness is about seeking pleasure, while others might define it as achieving specific goals.
So there's no one-size-fits-all definition of well-being.
Not really. It's a bit like a jigsaw puzzle, where each piece represents a different aspect of a fulfilling life. Think about it like this. Some people find fulfillment in achieving specific goals, while others prioritize pleasure and positive experiences. There are many different ways to achieve well-being. For some people, it might mean focusing on hedonism, which is all about seeking pleasure. For others, it might be about living in accordance with certain objective criteria or achieving a specific set of goals.
But if well-being is so personal and varies from person to person, how can it be relevant to public health?
That's a really important question. And it brings us to why the CDC has been increasingly interested in well-being. The CDC emphasizes that well-being is a valid outcome measure for public health because it goes beyond traditional metrics like morbidity and mortality. They have even incorporated well-being measures like the general well-being schedule and the quality of well-being scale into their surveys.
Okay, so public health isn't just about preventing disease or making sure people live longer. It's about making sure people's lives are good too.
Exactly. If you think about it, traditional metrics only paint part of the picture. Imagine a community where everyone lives to a ripe old age, but they're constantly stressed, lonely, and feel like their lives have no purpose. Would you consider that a healthy community?
That's a great point. Long life doesn't automatically equal a good life.
Precisely. The CDC is trying to capture this broader picture by measuring how people actually experience their lives. Their sense of satisfaction, their level of happiness, their overall quality of life.
It's like they're finally acknowledging that our mental and emotional well-being are just as important as our physical health.
Right. Absolutely. And what's even more fascinating is that there's growing evidence suggesting a strong link between higher levels of well-being and better physical health outcomes. People who report higher levels of well-being tend to have stronger immune systems and may even live longer.
Wow, so taking care of our mental and emotional health actually can have a positive impact on our physical health.
It seems that way. It's not just about longevity. It's about living a better life overall. And we're also seeing connections between well-being and healthier behaviors, stronger social connections, and even increased productivity at work.
So well-being is like this ripple effect that touches every part of our lives and even has an impact on the people around us.
Exactly. It's a powerful force, and understanding it can help us create healthier and happier societies.
This is already making me think about all the different ways we can cultivate well-being, both individually and as a community.
That's a great transition to our next topic. One of the most influential thinkers on this topic is the economist and philosopher Amartya Sen and his work on the capabilities approach.
I've heard that name before. Can you remind me what that's all about?
Well, Sen's work shifts our focus from simply having resources to having the freedom and opportunity to use those resources to achieve what we value in life. He argues that well-being is about having the capabilities to live a life that we find meaningful.
Okay, so it's not just about what we have, but about what we can actually do with it.
Exactly. For example, you might have access to excellent healthcare, but if your job doesn't allow you to take time off to see a doctor, it doesn't really help you, does it? Sen argues that well-being is about having the genuine freedom to use resources to achieve what you value.
It makes a lot of sense. It's not just about having things in theory. It's about being able to use them in real life.
Precisely. And this brings us to the concept of agency, which is central to Sen's thinking.
Agency. What does that mean in this context?
Agency in this context means having the freedom to make choices and take actions that shape our own lives. It's not enough to simply have options. It's about having the power to choose among those options in a way that allows us to live a life that we find meaningful.
So if we want to create a society that truly values and promotes well-being, we need to make sure everyone has that kind of agency, that freedom to make choices that shape their lives.
Exactly. And that's where things start to get really interesting when we think about the implications for public health.
This is really giving me a lot to think about. I can already see how this whole idea of well-being challenges us to look beyond traditional measures of health and consider the bigger picture of what it means to live a good life.
It certainly does. And there's even more to explore. But before we do that, let's take a short break.
Welcome back. Before the break, we were talking about how Amartya Sen's work on capabilities and agency challenges us to think differently about well-being.
And how that ties into creating a society that truly supports well-being for everyone. It's really making me reconsider what it means to have a good life. It's definitely a thought-provoking concept. And it has some pretty significant implications for public health, too.
I could see how that might be. But I'm a little fuzzy on how these abstract philosophical concepts actually translate into real-world public health policies.
That's a great question. Remember how we talked about the CDC emphasizing well-being as a valid measure of population health?
Yeah, they're looking at things like life satisfaction and overall quality of life, right?
Right. And that shift in perspective really aligns with Sen's ideas. It's about moving beyond just preventing disease and extending lifespan to actually focusing on creating conditions where people can thrive.
So public health interventions wouldn't just target specific behaviors or diseases. They'd also consider how to improve people's overall well-being.
Exactly. It's about recognizing that well-being is a valuable outcome in itself and a goal worth striving for in public health initiatives.
Okay, I'm starting to see the connection. But can you give me a concrete example of how this might actually play out in a public health strategy?
Absolutely. Think about smoking cessation programs. Traditionally, the focus has been on getting people to quit smoking, which is important. But a well-being focused approach would also consider how to support people's well-being throughout the process.
So instead of just focusing on the negative, quitting smoking, we'd also look at the positive, how to make people's lives better as they go through that change.
Precisely. Maybe that means providing resources to manage stress, build social connections, or find new ways to enjoy leisure time that don't involve smoking.
It's like we're treating people as whole individuals, not just focusing on one specific behavior.
Exactly. And this is where the idea of addressing the social determinants of health also comes into play.
You mean things like poverty, access to education, and safe housing?
Exactly. These factors have a huge impact on people's well-being. You can't expect someone to prioritize healthy habits or make positive changes in their lives if they're struggling to put food on the table or find safe and affordable housing.
It's like we're finally starting to see the connections between all these different aspects of life, how they all weave together to shape our overall well-being.
It really is about recognizing those connections. And it means that public health can't operate in isolation. We need to collaborate with other sectors like education, housing, social services to create environments that genuinely support people's well-being.
It sounds like this approach would require a pretty significant shift in thinking and collaboration.
It would, but it's a shift that's gaining momentum. People are recognizing that our well-being is influenced by so much more than just our physical health. Our relationships, our work, our sense of purpose, all of these things matter.
And by taking a more holistic view, we can start to develop public health strategies that are more effective and sustainable in the long run.
Absolutely. It's about addressing the root causes of health issues, not just treating the symptoms.
Okay, I'm getting really excited about the potential here. But I have to admit, I'm still a little unsure about how we actually measure well-being at a population level. It seems like such a subjective and personal thing.
That's a valid point, and it's something that researchers are still figuring out. There are practical challenges, but there are also some exciting developments.
Like what?
Well, remember we talked about the CDC incorporating well-being measures into their surveys. They're asking people about their life satisfaction, their sense of purpose, their social connections, all these different facets of well-being.
So they're not just looking at cold, hard statistics. They're actually trying to understand how people are feeling and experiencing their lives.
Exactly. And that data can be incredibly valuable. It can be used to track trends in well-being over time, identify disparities between different groups, and see whether specific policies or programs are actually making a difference in people's lives.
That's amazing.
Yeah.
It's like we're finally starting to listen to people's lived experiences and using that information to inform public health decision-making.
It's about recognizing that people are the experts on their own lives. And by listening to their stories and experiences, we can get a much richer and more nuanced understanding of well-being and how to support it.
This all makes so much sense. Are there any real-world examples of how a well-being-focused approach has actually been put into practice in public health?
There are, and one really interesting example is the work being done in the UK on well-being and social prescribing.
Social prescribing. That sounds interesting. What is that?
It involves connecting people to non-medical sources of support in their communities. Things like art groups, gardening clubs, volunteer organizations, things that can help people build social connections, find purpose and meaning, and improve their overall well-being.
So instead of just prescribing medication, doctors are prescribing social activities.
In a way, yes. It's recognizing that sometimes what people really need isn't a pill, but a sense of connection, purpose, and belonging.
That's really cool. It's like acknowledging that sometimes the best medicine isn't actually medicine at all.
Exactly. And the interesting thing is there's evidence that this approach actually works. Studies have shown that social prescribing can have a positive impact on people's mental and physical health and even reduce their reliance on healthcare services.
This is so inspiring. It's like we're finally starting to understand that health and well-being are about so much more than just our biology.
I agree. And it's exciting to see these innovative approaches being implemented and evaluated. We're still in the early stages, but there's a lot of potential here to transform the way we think about public health.
This has been such an eye-opening conversation. I'm feeling really hopeful about the possibilities, but I also want to know what our listeners can take away from all of this and apply to their own lives when it comes to well-being.
That's a fantastic question and one that we'll dive into more deeply after a short break. But for now, I think a key takeaway is that well-being is multifaceted and encompasses so many aspects of our lives.
It's not just about fleeting moments of happiness, but about cultivating a sense of purpose, building strong relationships, engaging in activities that we find meaningful, and creating a life that feels authentic and fulfilling.
Exactly. It's about the whole picture.
Welcome back. Before the break, we were discussing how recognizing the multifaceted nature of well-being can lead to more holistic and effective public health strategies. It's definitely been an eye-opening conversation, and it makes me wonder, what can our listeners do with all of this information? How can they actually use these insights to improve their own well-being?
That's the million-dollar question, isn't it?
Yeah.
Luckily, there are some practical steps we can all take based on the research we've discussed. One of the most important is to prioritize our relationships.
That makes sense. We've talked a lot about how important social connections are for well-being.
They're absolutely crucial. Nurturing our connections with family, friends, and community provides a sense of belonging and support, which can be incredibly beneficial for our mental and emotional health. Make time for those meaningful interactions, offer support to others, and don't hesitate to seek support when you need it.
So it's not just about having lots of friends on social media. It's about having those deep, meaningful connections in real life.
Exactly. And in addition to nurturing our relationships, it's also important to find things that give our lives purpose and meaning.
You mean like having a job we love or volunteering for a cause we care about?
Those are great examples. But it doesn't have to be something grand or elaborate. It could be anything that aligns with your values and passions, whether it's pursuing a creative hobby, spending time in nature, or simply being present with your loved ones. The key is to find activities that make you feel engaged and fulfilled.
So it's about figuring out what lights us up and making sure we're making space for those things in our lives.
Exactly. And while you're exploring those things that bring you joy and purpose, Don't forget to practice gratitude along the way.
Gratitude, you mean like keeping a gratitude journal?
That's one way to do it.
Yeah.
But it can be as simple as taking a few moments each day to appreciate the good things in your life, big or small.
It's like training ourselves to focus on the positive instead of getting bogged down by the negative.
Exactly. Gratitude can be a powerful tool for shifting our perspective and cultivating a more positive outlook, which can have a ripple effect on our overall well-being.
So we've got nurturing relationships, finding purpose, and practicing gratitude. What else can we do to boost our well-being?
Well, we can't forget about the importance of self-care.
Ah, yes, bubble baths and face masks.
Those can be part of it for sure. But self-care is really about anything that nourishes your mind, body, and soul. It could be exercise, healthy eating, meditation, spending time in nature, getting enough sleep, anything that helps you feel recharged and revitalized.
So it's not selfish to prioritize self-care.
Mhm.
It's actually essential for our overall well-being.
Absolutely. When we take care of ourselves, we're better equipped to take care of others and show up fully in our lives.
Okay, this is all making so much sense, but sometimes life gets messy and we make mistakes or things don't go our way. How do we deal with those inevitable challenges and setbacks?
That's where kindness comes in. Being kind to ourselves and others, practicing compassion and forgiveness can make all the difference. We all stumble and face difficulties, but by offering ourselves and others grace, we create a more supportive and resilient space to navigate those tough times.
It's like remembering that we're all human, we all make mistakes, and that's okay.
Exactly. We're all in this together. And these practices, while simple, can be incredibly powerful when we weave them into our daily lives.
This has been such an inspiring conversation. I feel like I have a whole new toolbox for cultivating well-being.
Me too. And remember, well-being is a journey, not a destination. There will be ups and downs, but by embracing these practices and cultivating a mindset of growth and resilience, we can navigate life's adventures with more ease and fulfillment.
Thanks for listening to the Well-Being Podcast. Take care, stay inspired, and see you next time.